LD50 determined for THC or for the synthetic Marinol? Is there an LD50 determined?
Not that there might be. I'm not familiar.
There almost has to be in the FDA archives an LD50 for Marinol, because you're required to produce such a number for anything that the FDA allows you to prescribe. I don't know what it is personally, and frankly,
would it be 2 or 3 bales?
I do think, and if anybody in this room can contradict me, I'd love to have it happen right now, but I'm not aware, and I say this to every patient that I certify, I'm not aware of any marijuana only or cannabis only overdose deaths. And I think it's a standing offer that lots of people have in the field, that if you can produce evidence that somebody's managed to lethally overdose on cannabis only, we'd like to know about it. Because up till this point in time, I don't believe it's happened.
Their website says the LD50 for THC is a value of 1,270 milligrams per kilogram, and that's in male rats. So.
In male rats, okay.
Right.
Yeah. We do in fact.
And 730 milligrams per kilogram for female rats. Just.
That does prove that you can hold the herb. I do want to comment on that, though, one real quick. I had to go to Canada for a stockholders meeting in 1991, and the Canadian government would not allow me in with my cannabis. They said that we don't let their patients in with theirs, so why should we let you in with yours? So I said, it's a war between the two countries. They said, yeah, you're a pawn in the war. So anyway, my doctor decided to give me Marinol, gave me 10 milligrams. He said, Irvin, try it the week before, because I don't want you to get on a plane and try it for the first time. So that Sunday morning I got up and I popped one, and he'd give me a prescription for 30. I popped one and waited about a half an hour, nothing. I popped 2 more, nothing. Waited about another 45 minutes, popped 2 more, nothing. And I'm not feeling anything from it, agitation, nothing at all. You know, my muscles tightening up. And here I've got all this cannabis just sitting there waiting to smoke, and I go, no, let me give it a real test. So I waited another half an hour, nothing, popped 2 more, and I just said, you know, that's it, I've had it. So I started smoking, you know, my medical cannabis. So then I went to one of the research, I think it was with the Institute of Medicine, and one of the doctors who was against us, I told him the story. He said, well, knowing your condition and knowing what you take, you should have taken 10 of them to begin with. Wow. And I said, wait a second, you're telling me that I should have taken 1/3 of the entire prescription at the first time? He said, well, that's what you would have needed. I said, no, thank you. I don't think I would take that chance.
Since the federal government is giving Irvin and other people medical marijuana or medical cannabis and writing a prescription for it, how can they not admit that it has medical value, and how do they keep it on a Schedule I drug list?
Well, I can easily answer that. Okay, the DEA and FDA has a Schedule I, which means it has no medical value, period. Okay, the government gives it to us not as a medicine. They give us an experimental new drug, not a medicine. When I had to sue Delta Airlines for not allowing me on a plane in 2001 when I was at the Supreme Court, when I won the case, DEA explicitly said that I do not have a prescription for medicine. I have a prescription for an experimental new drug, and I have every right to bring my experimental new drug onto a plane. So that's how FDA justifies, and that's how DEA justifies, you know, what they believe to be. And of course, what I always argue is, well, you're giving it to me for medical reasons, and the fact that you've given me over 120,000 medical marijuana cigarettes so far, you would think that maybe they might want to research us at all, especially when they say they're doing research. You know, and the only time that any research was ever done on federal patients was done here in Montana. Okay, in 2001 by Dr. Ethan Russo in Missoula. And he did a complete evaluation on 4 of his patients. We did brainwave testing, IQ testing, respiration, memorization. We did everything. And all 4 of us were perfectly normal. So it's...
Ethan said that?
Yes. Ethan said that. Ethan said that. So, you know, the point being is that the government doesn't want to recognize that it's medical. Okay, that's simple. It's all because of the pharmaceutical industry and the lobbyists, and it really comes down to. And of course, what's been done now, and what people do not realize, and I want to emphasize this, I can't emphasize this enough. The VA, 6 weeks ago, government doctors stated for the first time that medical cannabis is a medicine, period. End. Now, this was done by Michael Krauss, okay, a veteran who had been using opiates for his disorder, and then 5 years ago, all of a sudden, they wanted him to sign a release saying that he had nothing else in his system. If he did, they would stop treating him with opiates. He wouldn't sign that, and he took about educating the VA. This is what came out. This was done through Patients Out of Time. Now, Patients Out of Time is an organization that I'm a director, and all we do every 2 years is purely medical. We have the top scientists, we have the top doctors, we have the top clinicians, nurses, patients, present what they've done for the last 2 years. The AMA, the American Medical Association, sanctions this conference to where doctors get CE credits. If this wasn't medical, they wouldn't give a doctor medical credits. The ANA, the American Nurses Association, sanctions our conferences to give nurses CE credits. If this wasn't medical, they would not sanction these CE credits. If a doctor is not able to attend our conference, they can go on the website at University of California, San Francisco, pay a fee, download our conference, get their CE credits. If this wasn't medical, this would not be accepted. So therefore, it's just a play on words.
What's the website that a physician could go to and download that?
It's medicalcannabis.com is the website. Or University of California, San Francisco, you can go to their website also and go to download that.
What will it take to get it removed from a Schedule I status, do you think?
I think that we're very, very close to that. There's reclassification hearings going on that's been going on since the 70s. We're getting much closer to that now. I mean, after almost 40 years. Okay? So I do believe that we're closer in that respect. And just the simple fact that the federal government agency, the VA, came out saying it's medicine. I mean, the government's just swept that under the table. We've got to emphasize that more, saying when the government says, well, the government's never come out and said it's medicine. Bullshit. Yes, you have. The VA's done that. Okay, and so I think that's what we need to emphasize.
Based on that, do you think Montana is a little behind by not having PTSD as a recognized application for medical cannabis?
Well, I think all the states and everybody's behind in recognizing the aspects of medical cannabis for different disorders. PTSD now is being researched in Israel. Look, 2 years ago or 3 years ago, Israel had no patients. Today, thanks to Rick Doblin and some of his people, they've got almost 3,000 medical patients, and they're researching the different cannabinoids. And of course, the grandfather, Dr. Mashul, was from Israel, so he's been a big part of that. So, you know, none of the states, I applaud Montana because, my God, compared to my state of Florida, it's recognized way more illnesses in Florida, so I applaud what Montana's done. That's why I'm here, I just want to help them.
Thank you.
This is kind of along the same lines, but last year the American Medical Association petitioned the U.S. government to reconsider its classification of cannabis as a Schedule I narcotic. Does anyone have an update on where that petition stands?
Well, actually, the AMA did it under duress. It was actually the American College of Physicians, that group that represents the internal medicine specialists in this country, put out a position paper that forced the AMA's hand. And the position paper by the ACP, the American College of Physicians, which if you see an internist, almost all internists identify with that professional organization. And they requested a reclassification before the AMA. I can't tell you what the status is because basically I don't have the time to follow what games the DEA is playing. And they're the ones that have to actually rule on it. But both ACP and now the AMA and a large number of medical professional organizations have said we want to study it. We want to at least resolve the rumor that that there's no scientific evidence. There's plenty of evidence. I mean, one of the things I brought this with me just is John Masterson here? No.
He's out setting up his booth.
He said about that. No. Tell him to stick his head in here. So now, this is the publication that Normal puts out that I tell all my patients about. And if you haven't seen it, you ought to see it because just looking at the cover of this, and I'll acknowledge that my copy came from Tom Dover. Okay, the cover of this is enough to change minds. The cover of this little medical bibliography is enough to take a spouse who doesn't believe that their partner is really doing something legitimate and convince them just by looking at the range of pathologies. Yeah, I saw it. Did you bring these with you?
I may have one.
put it on the table, glue it down, and let people look at the cover. Because the beauty of this little booklet isn't that it's comprehensive, that it covers all the evidence that's out there about how marijuana can be useful as a medicine. It simply gives you such a phenomenal range that by the time you've acknowledged that it can be useful for everything from hepatitis C to diabetes to high blood pressure, you're beginning to think, wait, how many different conditions does cannabis influence? And the answer is, we don't know yet. We haven't spent enough time investigating it for all of its medical properties. But everybody in this room gets the opportunity, I believe, both as patients and caregivers, to help answer this question. And if you can get your personal physician to listen to you as a patient when you talk about how it helps you, then the knowledge base is going to expand immediately. I'm not saying that they will listen to you, but I think each and every one of you ought to try.
I have a question here for you, Dr. Christensen. When you use specific drugs, okay, opioids, for example, or amphetamines, there are certain specific changes that happen within the brain. I guess I have a two-part question here. First of all, are there specific aberrations or changes that happen in the brain of chronic cannabis users? And also, too, why is the toxicity of this herb so low? Why is that the toxicity is so low in the body?
Okay, I'll do number 2 first, because it's the easy one. It is what it is. I mean, the truth of the matter is, you've got a substance that the plant has, depending on who you read, okay? I've quoted 50 to 60, but in Canada they upped it to 60 to 70. You've got 60 to 70 separate biological compounds in cannabis, okay? Noel was giving you a little bit of terminology, which it's helpful to back up very quickly because you all are going to hear these things. So there are 2 receptor types that have been identified by the initials CBD1 and CBD2. Okay, they're CB, yeah. The D isn't there. CB1 and CB2. There is shorthand for a specific cannabinoid, which is CBD, and the terms anandamide and 2-AG reflect the 2 molecules that have been specifically identified in the human brain. We started out with lower animals, but you're all sitting here manufacturing, I hope, some anandamide and some 2-AG because they're endogenous molecules in your body. And when you talk about any substance that's out there that we can utilize for medical purposes, there are darn few that represent exact duplicates of compounds that are being produced in the body. There are no prescription opioids that are identical to endorphins. That's why the term endorphin exists. It's a shorthand for endogenous morphine-like molecules. So all opioids are an attempt to mimic an endogenous molecule, but marijuana contains 2 molecules that are native to the human body. It makes it tremendously unique, and it gives tremendous weight to everything that Irv has said about forcing the recognition that this is in fact medication.